is Sarah Ray. Welcome to my channel. I hope you all are doing well. Welcome to IBD Awareness Week. That is December 1st through the 7th of every year. IBD is Crohn's and colitis, which I have Crohn's disease, so I do love spreading as much awareness as I can on these topics. Each year since I started my channel, I have covered IBD Awareness Week, so I will link a playlist of all the videos I've talked about during IBD Awareness Week. I had a video I originally wanted to do before now. It was on Friday and I wasn't happy with it, so I ended up scrapping it, and I kind of feel bad that I haven't posted anything before now, but it's okay. Everything happens for a reason. With that, what are we talking about today? For me, it's a very important topic and one I feel doesn't get talked about enough. And that is, do insurances overstep their bounds when it comes to medications? We're going to talk about prior authorizations and what is step therapy reform and why is it important to know about. So with that, if you guys are liking my content, make sure you take a little bit out of your time to subscribe, turn your bell notifications to on so you can get all of my content. Let's jump into this explosion of a topic. Let's first talk about what is the role of health insurance. So health insurance protects you from unexpected high medical costs. It is the amount you pay for covered health care services before your insurance plan steps in. So, for example, say you have a $2,000 deductible. Once you hit that $2,000 deductible, once you've racked up enough bills that hits that $2,000 deductible, your insurance plan then steps in and covers the rest of it. So that's why a lot of times at a certain part of the year, you'll see that you will hit that deductible and medications, certain costs will become cheaper or free than at other time of the year. Something that is sad is that roughly 30 million Americans of all ages are without health insurance. That is 9.2% of the population. Now, I'm not at all saying that insurance is bad, but I do believe that sometimes they overstep where they shouldn't. Insurance is there to help you, again, better cover services needed when it comes to your health. In this day and age, they a lot of times can actually dictate what medications you can and cannot take. Take, for instance, there is something called prior authorization and step therapy reform, which are the two big things I want to talk to you about today. Let's first talk about step therapy reform, and I will also tell you why insurances get involved. So, what is step therapy? It's also known as fail first. So, think of a doctor wanting to prescribe you a med, but insurances want you to do a different med first, fail, before paying the coverage on the original med the doctor wants you to do. So think of the doctor saying, oh, I want you on this med. The insurance goes, no, try A, B, C first, fail at all three of those, then we'll consider that original med the doctor wanted you on. In my personal opinion, I don't think they should be allowed to do that because the prescriber, the doctor, has gone to school for health, knows about these diseases, illnesses, medications that help. The insurances, they really don't know that in-depth information. So how they can choose that, your guess is as good as mine. And actually, why I'm talking about this over IBD week is because over 40% of people with IBD go through this. And this process can not only be physical, but emotionally draining for anyone going through this, not only people with IBD. So why do insurances get involved like this? Well, as they say, cost containment strategy. But with statistics, we've actually come to see that it's led to a higher overall healthcare cost. So what I'm getting at here is you're taking a less effective med. It's a higher cost than taking a more effective med at a lower cost. I hope that part makes sense. we have seen an increased number of plans implementing this step therapy. In 2005, it was only 25%. In 2013, it went up to 67%. However, the CCFA, which is the Crohn's and Colitis Foundation of America, they did a survey in 2016 which involved 600 patients, and 40% of them were subjected to this fail first plan. But not only that, 57 were required to fail 2 medications or more. 60%, the doctors were unable to even intervene. 32% delayed from optimal plan over 7 months. And 94% believed step therapy to be a barrier to timely and appropriate care. Doing this fail first, not allowing them to have the medication the doctors are wanting them to have first. The insurance is stepping in and dictating what medications we should take, is doing exactly that, a barrier between appropriate care that we should deserve and rightfully pay for when it comes to paying for health insurance. When we look at IBD alone, the impact step therapy has alone is things like disease progression, adverse reactions. They don't see a need for individual plans, what I call robots. Everybody thinks everyone deserves the same thing. There's no individuality. Newsflash, not everybody's the same. Everyone don't react the same thing the same way to everything. Everybody's disease is different. It's formed different. It's triggered to different things. An individual plan is the only way to help people individually. There's never going to be one set treatment. Also some received no medication, period. Now, what's the difference between prior authorization and step therapy? So, prior authorization is just prior approval. He's going under the blanket. Pretty much, a prior authorization is prior approval. It is physicians and other healthcare providers obtaining advance approval from the individual's healthcare insurance before a specific service is delivered for the patient to qualify for payment coverage. This also includes medication. So they ask beforehand, will you cover this? This is what we are wanting to do, what we're wanting to give them. Will you accept this? And this is why they're both very similar, because sometimes they will say yes, sometimes they will turn to fail first, step therapy. They'll say, no, we want you to do it this way, A, B, C, fail at that, and then we'll do your medication you want. Sometimes they'll accept the prior authorization. I hope that makes sense. It can be quite confusing, but I don't think it should be this way. I don't think insurances should be allowed to dictate what we have access to. They don't deal with us individually. They don't see our progression and degression in our health, illnesses, mental health, all of that. They don't see that, yet they have a way to dictate what we are capable of taking and not taking. I don't think that's right. But then again, I'm speaking from my own point of view, my own thoughts, and what I've dealt with. I always want to hear your thoughts, what you've dealt with when it comes to insurances, medications, and such. I do think there needs to be individual plans. Fail first really is a fail on insurances, and it needs to be preferred drug first. It's not patient-centric. On the bright side, some states are starting to do things a little differently. And that's kind of why I am bringing it to you, because the CCFA is trying to change things. I will leave a link to CCFAs. We're trying to change things. I will leave a link. You can click on your state and see what you can do to change this so that it's in the hands of the doctors and not so much in the hands of insurance. I will leave a link to the CCFA's website where you can click on what your state is doing to change things. What exactly they're working on is trying to create a balance between ensuring the overall health of patients, containing overall health care costs. The big thing is the biology of each person is individualized. So step therapy reform can help some, since we all respond differently to the ingredient of each med. Like I said earlier, everyone responds differently. You can have two people, one benefits from one med, one benefit and one doesn't. One has side effect, one doesn't, or the other one has helpful side effect. Everyone's individualized, and we need people to hear that out. And lastly, to remind people that doing this fail first, the step therapy, we also need to make sure people understand if we have it the insurance's way, the fail first, however many meds they want to put in front of us before we get the med the doctor wants us to have, that can delay or lower care quality, which means disease progression. Instead of moving forward and doing better, we're getting worse. I hope all this makes sense, and I hope you guys will help spread the word of these words and get it out there. And I hope all this made sense. I hope you guys hear me and you guys will look into this and see what your states are doing to change this, what your guys' thoughts are, because maybe you see it differently. Maybe you guys are for the way insurances do it. Because remember, I honestly believe no one's views are wrong. If you see things completely different than mine, you're not wrong either. I would love to hear what your thoughts are on this topic, because it's very important. Thank you guys so much for watching. Stay safe and well. Remember to check the description box. Everything you need is right in there, and I will see you guys in the next one. Bye.